Who is a pathological liar? A pathological liar, also known as a compulsive liar or someone suffering from pseudologia fantastica, is a person who habitually lies, often without any clear reason, benefit, or external pressure. These lies are typically exaggerated, dramatic, and often easily disproven, but the liar tells them with confidence and emotional conviction, making them hard to detect or confront. Psychological traits of a pathological liar. 1. Chronic behavior. They lie often, not occasionally. Lying becomes part of their personality. 2. No clear motive. Unlike typical lies, which serve to avoid punishment or gain something, their lies often serve no obvious purpose. 3. Delusional beliefs. Over time, they may start believing their own lies. 4. Lack of guilt or remorse. They often don't feel bad for misleading others. 5. Manipulative tendencies. Some pathological liars use lies to control or manipulate people. 6. Low self-esteem. Lies may serve as a defense mechanism to cover feelings of inadequacy or inferiority. 7. Attention seeking. They often lie to gain admiration, sympathy, or status. Difference between normal lying and pathological lying. Type of liar motivation. Frequency awareness. Occasional liar to avoid trouble or gain benefit. Rare. Usually aware, compulsive, pathological liar. Habitual, often senseless lying. Frequent, chronic, sometimes unaware. Sociopathic liar. To manipulate, hurt, or exploit others. Often strategic. Fully aware, examples of pathological lying. Example 1. Personal identity. A person falsely claims they are a doctor when they have no medical degree. They served in the military or were in combat despite having no such record. Case example. Brian Williams, a famous NBC news anchor, falsely claimed he was in a helicopter hit by enemy fire in Iraq. The story was untrue, and he was suspended when the truth surfaced. Example 2. Fake achievements. They boast about owning multiple successful companies. Example. A man lies about having a PhD and a Harvard education to impress a potential employer, despite only having completed high school. Example 3. Medical lies. Claiming they have serious illnesses, like cancer or heart disease, to gain sympathy, attention, or money from others. Case example. A woman in the U.S. faked having cancer and raised thousands of dollars in donations. She shaved her head and wore hospital gowns to make it more convincing. Causes of pathological lying. Personality disorders. Narcissistic personality disorder, borderline personality disorder, or antisocial personality disorder. Childhood trauma. Abuse, neglect, or growing up in a dishonest environment. Need for validation. Lying becomes a way to feel important or valued. Neurological factors. Some studies suggest abnormalities in the brain's prefrontal cortex, linked to impulse control. Is pathological lying a mental illness? While not officially classified as a standalone mental disorder in DSM-5, Diagnostic and Statistical Manual of Mental Disorders, it's often a symptom of deeper psychological conditions. Psychiatrists may treat it under the umbrella of personality disorders or impulse control disorders. Can pathological lying be treated? Yes, but it's challenging. Common treatments include cognitive behavioral therapy, CBT, psychotherapy, medication, if linked to anxiety or other disorders, honest communication with loved ones, and interventions. However, many pathological liars refuse to admit they have a problem, which makes treatment harder. Impact on others. Being close to a pathological liar can lead to broken trust, emotional trauma, financial loss, reputation damage. Summary. Feature: pathological liar. Frequency: chronic motivation. Unclear or attention-seeking emotional awareness. Often unaware, belief in own lies often starts believing them. Treatment: difficult but possible.